करने के लिए तो मना नहीं है, तो उसमें
क्योंकि मैंने
कंसीडरेशन है टोटलिटी।
यहाँ ये तो पता है टोटलिटी। ठीक है ओवरऑल सर, हमारा टाइम अब खत्म हो गया, अब सर भी डिस्कनेक्टेड हो गए हैं। हाँ, सो थैंक यू वेरी मच, जितने भी हमारे पार्टिसिपेंट्स हैं जुड़ने के लिए, एवरीडे हमारे सेशन में जुड़ते हैं, सबको बहुत बहुत धन्यवाद। अब हमारा हिंदी सेशन खत्म हो रहा है और इंग्लिश सेशन स्टार्ट होने जा रहा है। सो अभी मंच में डॉक्टर हुबर्ट को हैंड ओवर कर रही हूँ। ओवर टू यू सर।
Thank you, Deepa Madam. So, Hanisa, today, our 23rd February 2024, our 1271st day of our Zoom meeting. Before starting our Zoom meeting, let us have an all-minute silent prayer. Thank you all. Today, our guest is Dr. Prakash Rao BA, MD and PhD. We know that he is a scientist, an intelligent person who is working hard to make our homeopathy a new high-level science. Because homeopathy is very difficult for us to prove that all in a visual media, or we can explain it in. Normally, it is very difficult. But studying how to proclaim the science of homeopathy is doing wonderful effect. So, just a minute. I invite Dr. Prakash Rao for this platform, and just we have to see whether what is he. Dr. Prakash Rao, MD, PhD, holding a postgraduate diploma in physical medicine and rehabilitation. Undertook project with UNICEF and AIDS Control Society, and the winner of many awards for the outstanding work of homeopathy. More than 30 years of experience at Central Council of Homeopathy. Today is subject, what is cure and curative? The meaning of, we are always searching the meaning of what is cure and curative. Sir, are you ready, sir? I
Yes,
cannot
sir.
see you.
Yes, sir.
Your face cannot be seen.
Can you hear me, sir?
Yeah, you are here. Yeah, it is audible.
It is audible. Okay.
Yeah. We like to see your face also.
Yes. Muted, sir. Sir, I am getting Zoom is unable to detect camera.
Okay, sir. Then yeah, everybody knows you. That's
Yes. Sir. Thank you very much. Thank you very much, Dr. Hubert De Silva, for introducing me at a high level. Just I am sharing my knowledge with you people. And you all are senior doctors. So today I selected my topic is what is cure and curative. But before that, I thought that this cure and curative starts in the practical part of organon of medicine. What we will cure, what is curable, what is cure, and how it will be cured. So I prepared statistics, but they are incomplete. So before that, just I want to again remind you people just to what is because this is scientifically statistical wise designed methodology of what is cure, what is curable. In this cure, what happens, which is the medicine? Suppose everybody is giving prescribing arsenic. Why the arsenic will be prescribed more? Why not zincum metallicum? Why sulfur is prescribed more? Why not rus aromaticum? Why the aconite will be given more modalities about fear of death, anxiety? What are the causes? What are the symptoms, signs and symptoms that they are producing? Why they have been produced? Why it is being utilized? Why not arsenicum sulfatum flavum is used instead of arsenic? So they come under what is curative. And what is cure, which we can cure, which we can't cure. The homeopathy is a system of medicine which is developed by Hahnemann. Just practically seeing in those social architecture was like this. It is just originated against allopathic system of medicine. In our philosophy, organon of medicine, we have pages together criticizing the allopathic doctor's attitude, allopathic doctors' medicines, their pharmacology, the side effects, the contraindications, their approach to the patient on pathological basis. So in those days in the society, the attitude of the doctors, how cruel it was. So it was an open challenge to allopathic system of medicine. For about 150 years, the homeopathy system of medicine has dominated total world, and the homeopathic universities were established. It came from France, Germany to America, and there were homeopathic medical colleges. The last edition of the Kent lectures was published in 1936. So how popular it was, and the Royal London Homeopathic Medical College, suddenly how the shape has been disappeared. What is the lacuna that comes under curative aspect and curable aspect? For that, I prepared statistics. We have made one on studies on around 30-35 clinics, and we have gone to different doctors of different styles in different cities. We have taken their statistics. But before that, I thought it comes under evidence-based medicine. So I thought that just to remind you about what is evidence-based medicine today, then we can go for what is curative and what is cure. Sir, if you give permission, you may see my face. I think you have to, from there you kindly see that video.
Hello.
Hello?
Hello.
Yes, can you hear me, sir?
Yes, sir, we can hear you, but your slide is not changing, sir.
Yes, madam. Now?
Yeah, now it's changing, sir. Yes, we can see it now, sir.
Okay, ma'am.
Yes.
No, okay, sir.
Yes, sir.
No, okay.
Now, before that, so what is curative? What is curable? What is cure? So, what is cure? Before that, I thought that just make you afresh of the evidence-based system of medicine, so that you will understand. You will can discuss with me the evidence-based organon of medicine. See, organon of medicine, even among the homeopaths, the organon of medicine means it is a storytelling, and it is some of the principles that Hahnemann told, and they were irrelevant, and they were not up to the mark. But it is not like that. We were successful for about 150 years, and we are successful even today in curing various the cases which were denied by the allopathic doctors. The only problem with us is we haven't maintained the proper documentation. Not maintaining the proper documentation and not maintaining the video. Nowadays, from last 10 years, we are from 20 years, we were having a facility of video also, but no physician is in a position to record those success stories, because the disease, how it progresses in the body, can be examined by the parameters or what we call as the tests or the investigations and technicality. But at the same time, the cure also will be known basing upon the pathological investigations and patient well-being and not recurrence of the disease for more than 3 years. These statistics, these documentation is not managed by the physicians, but in general, the total population of our country are dependent on homeopathic system of medicine also. So that's why the government is forced to run. We have to yet to work on our documentation and make homeopathy very easy so that the documentation can be possible. So for that purpose, we have carried out a research, a clinical research on organon of medicine, not the clinical studies of COPD or bronchial asthma. They are different. They are there to show that medicines are effective. But how the reality and the reliability of the organon lies, those clinical studies, investigations, I have to share with the statistics with you. So before that, it is better to have evidence-based system of medicine. Sir, just a minute, sir. I am trying on my computer to show my face. Sir. Yes. Sir, now you can see my face, sir.
దాంట్లో మాటలు వీడియో పెట్టుకో ఇక్కడ స్క్రీన్ షేర్ చేసి
Okay. Sir, can you hear me, sir? Can you hear me, sir? Okay. Sir, now what
We
is
can see you, sir. Okay.
medicine? Just I am reminding you, you might have heard this around 1 year, 2 years back. Evidence-based medicine, continuous, explicit, and judicious use of current best evidence in making decisions. What we have to make decisions in our medical practice in day-to-day life. For the basic care of the individuals, we have to make the current use of system of medicine to take good decisions judiciously, morally, legally, ethically, and scientifically. This is known as evidence-based medicine. What evidence-based medicine, what is the first fundamental function of the evidence-based medicine is? Evidence-based medicine, again I am telling, sir, repeating, explicit, judicious use of current best evidence of making decisions as above care of the individual patient. It depends on evidence-based guidelines. It depends on qualification of evidence. See, we cannot be going on showing evidence for simple fever, or we cannot show evidence for dandruff. We cannot show see falling of hairs, evidence for falling of hairs. See, daily around 30 hairs may fall. After we give the treatment, the 30 hairs may grow. But until and unless it is alopecia areata, we cannot show it evidence-based. See, we cannot show small injuries or small prickly heats on evidence-based before and after, because they are routine practices. We cannot show some of the private parts, warts, small things, nails changing the color, and after treating with homeopathy. So they should have some qualification where we can take the pathological investigation, where we can take one X-ray scanning. Suppose there are renal calculi or stones in the kidneys. So once after the treatment for 3 months, 6 months, starting from 1 week to 6 months, So before treatment, during treatment, after treatment, what is the general condition of the patient? What are his parameters? So those all can come under the qualification, minimum qualification for evidence. Patient will come for different types of diseases. Sometimes he will have mental symptoms, fear. How to show that he is having fear? We have to record his whatever he says. Then we have to what are the parameters for selecting that he is afraid of company? How to show it? Does it comes under evidence? How to show that he is having loquacity, talking too much? What are the parameters to show that he is talking too much? Night sleeplessness. We have to believe the patient words. We have to treat him, and we have to say that he has been treated. So for that such type of evidence, we have named it as qualification of evidence. We have to take in writing from the patient that after 3 months of treatment, I am sleeping now 7 to 8 hours without dreams in the night time. I am in a position, my health has improved. We can show his general parameters like head, weight, chest, height, weight, chest, general nourishment. We may take 2-3 pictures. So this evidence also, everybody talks about evidence, but what is actually evidence that they needed in the case that we are treating is not known to the critics. So the allopathic doctors will say that homeopathy don't have evidence. See, one person has treated obesity, patient lost around 10 kilos, and he don't have any evidence. He gave some of the medicines for obesity. He treated obesity. He treated cholesterol. He don't want to show evidence. It is not like that. The obesity never comes under evidence-based system of medicine, because he may lose today 10 kilos and we may make him all right. By the age of 40, he may again gain the weight. Weight dependence, it is one is genetic problem. Despite that, we were successful to treat him. So before being criticized, the critic must know that what we are demanding from homeopathy, whether are we in a position to scientifically show some of the cures of some of the diseases with allopathic system of medicine. So when we are not in a position to show in allopathic system of medicine about some of the cures, how can we ask from homeopathic doctors also? So they do not know the minimum qualification for evidence. So the diseases that have to be shown in evidence are entirely different. That's why I would like to take the cure and curative part next time, because that comes under some of the curative products, some of the cure of the diseases, they never come under the evidence-based medicines qualification. Then statistical measurements. Suppose think that chylonychia. Chylonychia, how many cases of chylonychia? What statistics we can take for chylonychia? See, because we will be going on treating the patients. So the patient, actually statistics are chylonychia. Out of 100, we will get around 3 patients. So if we see around 1,000 patients, we may get 30 patients. If we see chylonychia patient for about 30, out of that 15 will take treatment, because the nail growth is around 0.01 micro millimeters per day. So to grow a new nail, it takes 1 year time. So 1 year time, usually they won't be under our treatment. They will be cured of chylonychia. They will grow a new nail, but they won't come to us for showing the evidence to take the picture. Moreover, that this is also not comes under evidence-based qualifications. So such things are being criticized nowadays, that they will tell that you don't know the mechanism of action of the medicine. We do not know, but if mechanism of action of medicine is not present, means patient never responds to treatment. When a patient responded to treatment, now I was listening to your previous topic in Hindi on COPD. So if patient never responds, how the medicine acted? So there is mechanism of action. There are no gadgets to know where homeopathic, there is no infrastructure to know where the homeopathic medicine is acting. See, if we give him grams, milligrams, micrograms, or even according to vaccination theory, we can find out the immunological modification in vaccination, in pathology, physiology, the material doses. But this is energy doses we can measure in energy, and we can measure in immunological modules. We can measure in some of the pathological modules for renal calculi, but we cannot measure the pathways of the milligrams like what we treat a case of fever in allopathy with paracetamol. You might have seen where paracetamol goes through blood, how it will be transported to the brain, how it controls the respiratory centers of the brain, how it controls the temperature. In homeopathy, it reaches brain center earlier than that, and it cures and it makes the temperature to come down. It never takes even 1 hour to cure the patient of a high temperature. This will not be reproduced in other patients because we have a laborious process of identifying the individual medicine. Selecting the individual medicine is not an easy job. It is a very tough task. Our experience never works out. For a homeopathic doctor, each case is a new case. Whatever the experience of a homeopathic doctor works only to maintain the artistic part of the clinic and environment and patient psychology, but it never helps in scientifically selecting the accurate individual medicine. So each case will be new case because we have framed a law that similia similibus curenter. So to select a similum is a toughest task for any great physician. Our art of treating the patient lies on our popularity. So that art will not be converted into science until and unless we study too much. So it is a laborious, intellectual, individualistic process, and every homeopathy doctor is a researcher because his start process to the last case of the fever and this case of the fever, the present who is being treated, the person who is waiting outside in the chamber, or the person who has been treated and given medicine before this patient, are three different entities, three different cases of fever. For example, three patients may be COVID patients, but three medicines will be different. So a homeopathic doctor will be always a researcher. We will call ourselves as a physicians. So doing research job in physician's practice is always needs intellectuality, hard work, as well as full knowledge of all the latest scientific material. Despite all these things, we give medicine, it works because it is the spot decision that will make us to give prescription, and it is the sixth sense that will make us to be a successful homeopathic doctor. But unfortunately, maintaining the document is the toughest task. Not maintaining the document is making us to be criticized by every doctor today. So the quality of clinical trials publication in evidence-based medicine. The quality of the clinical trials, what are the qualities? Even in allopathy, they were not present around 30, 40 years back. In 1960, even the allopathic doctors were not in a position to know what is the quality of the clinical trials. If you see in 1960 articles, they used to write like an essay. Now the writing articles has entirely changed. Now the data, statistics, artificial intelligentsia, then the methodology of writing the research articles, methodology for writing the books, methodology for noting the statistics entirely has changed. Now the homeopathy which was successful before 1960, successful in the sense more successful than allopathy, I am telling, and it is being remained because the fundamentals of the homeopathy have not changed, and the allopathic research which has taken various researches, but they were not in a position, they neglected homeopathic research. Have they taken the homeopathic research, their system could have been more successful than at present. They could have boasted that the success rate could have been around 98%. So they left the theory of similia similibus curanter. Leaving the theory of similia similibus curanter, they started copying isopathic theory of vaccination, isopathic theory of curing cancer cases, and the part of the organon, that is the individualized medicine, which has taken the shape as genetic medicine or personalized medicine or crisp medicine, and taking personality changes. Have they read the homeopathic books? Their research could have been evolved more differently, and there could not have been any difficulty for the general people to have a better treatment and better lifestyle today. But they neglected, they opposed the homeopathy and homeopathic research. At the same time, they never understood the lessons why the Hahnemann has created homeopathy against allopathic doctors. So they took it as a personal prestige, pride issue instead of a scientific issue. Now they are being converted to homeopathy. Now they are telling that we know that there is success, but we don't know how to measure it. Now that is the quality of the clinical trials and publication where the homeopathic doctors now learning, and it from up to the last 5 years, what allopathy was in 1960s, homeopathy used to be like that. From last 5 to 10 years, the homeopathic publication also changed. The quality of the clinical trials also in homeopathy.
Sir, it is not audible, sir. Audio is
Now,
not
sir?
coming. Yeah, now we can hear.
Okay. So the effectiveness of allopathy is
Now some of echo is there.
echo is coming, sir, because
Yeah.
I am speaking from both. Can you
Okay,
see my picture, sir?
One should be stopped, sir.
Yes, sir. Now,
From one device you talk, sir.
sir, you give me permission for my mobile phone, sir.
Okay, but you raise your hand. Okay.
Sir, now it's okay, sir.
Okay.
Right. The ineffectiveness of the evidence-based practice. So, insulin-dependent diabetes, that case comes to us. So, we will be thrilled. We want to treat it. But sometimes we may also, the case which we like more, it is very tough to treat. The insulin-dependent diabetes, there is no cure or the treatment available with them also. So when that is not available, they never say that the treatment or cure is not available for insulin resistance diabetes, and they say that they are not responding to treatment. If they call a homeopathic doctor to their hospital, and if a homeopathic doctors with their integration applies the medicine, the resistance towards the insulin will come down. When the resistance to insulin come down, they can apply the insulin, they can perform the necessary surgery if patient is in need, and they can utilize the homeopathic system of medicine. But their minds are not open because they do not know the evidence that is not present for their insulin resistance, and they also think that no other person in the world knows this. So this is the difficulty with allopathic doctor's attitude. The same thing was prevailing in Hahnemann days. So he invented, out of the frustration, he invented a system of medicine only to go against the allopathic system of medicine. That's why the organon of medicine has been written by him. Now that organon needs the scientific ability. So for that, we have to make guidelines. See, the homeopathy is a substitute for allopathic system of medicine. So what we did is, we started treating only chronic cases. We started treating the incurable cases. We were habituated to treat that because why this habit came? Because of the individualization. Why individualization? The laborious process. Whereas we can cure a injury case with arnica, we can cure another brain injury case or skull injury case with natrum sulf. Despite all these things, we were not in a position to show our skill in evidence-based manner. There we failed. That's why the lacuna of evidence-based medicine or what is curable. See, in our syllabus, in our colleges, we are treating various cases every day. But what are the cases that we are treating? What is the possible with homeopathic doctor? How he has to practice once he goes out of the college? Whichever is best possible treatment that is available for which disease. These were not taught in our curriculum or during house physician period. So a doctor comes out without self-confidence and he starts treatment, and he will be in oblivion. He will be in a confused mood. He don't know what case he can cure. See, I will tell you one of the case in homeopathy which is most successful. All the allergies we can treat. All the primary complex patients we can treat. All in the sense, sir, 90%. Why the 10%? Always science will be the maximum success rate of the science. The available science on human beings today is not more than 90%. The paracetamol works only on 92% of the patients for fever. The 8% of the patient never responds to paracetamol for controlling the temperature. So when the highly developed allopathic system of medicine is not in a position to cure all the cases of fever up to 100% in homeopathy, which we have done. So the maximum research, we cannot claim that all the 100% cases are curable, but we homeopathy can reach up to 90%. So such type of studies were not made, and a student was not taught. Suppose endometriosis. Endometriosis is a commonest disorders after PCOD, after the chocolate cyst in the ovaries that will spread into the ectoderm, endoderm, mesoderm of the uterus. From that, it also will be extended to walls of the intestines, the outside the uterus. So endometriosis, they will be totally infertile. But sir, here the 100% success, that is, if 100 patients of endometriosis are coming, the 90% of the cases in females are cured by homeopathy. This is not taught in our curriculum or in our syllabus or in our college, and they do not know that is curable. The sinusitis first grade and second grade. The otitis, chronic otitis media, first grade, second grade, and third grade is curable. The brain tumors of the first grade, the skull injuries, where patient will get in giddiness and he will go for MRI scan, then they will say the skull injuries are not curable, sutures are needed. The patient age never permits to give him anesthesia, the injury being not treated, and various injuries in a tuberculosis patient. See, an old tuberculosis patient will develop head injuries. Those head injuries are not cured. When they are not cured, the allopathic physician will confuse. They will advise him surgery. The anesthetist says that surgery is not possible. Then they will do the biopsy. They will find the fungus as well as tubercular infection in the injury. That injury is not being cured by allopathic doctor. With a single dose of any homeopathic medicine at that particular time. You may ask me, what is the homeopathic medicine? Starting from tuberculinum to natrum sulf, from arnica montana to ledampal to hypericum, whichever you think that suitable at that time will cure the injury, along with the allopathic medicine. See, such a type of integrated, wonderful approaches are there, but the allopathic doctors think that homeopathy is unscientific. At the same time, they will tell that they are so ignorant that they write an article that homeopathy has produced a side effect. A side effect of the medicine will come when it has reached successfully curing the patient around 90%. Then only the 8% of the patients will go for side effects and bad effects of the medicines. How the Naxwamika will produce bad effects on liver when the bad effects means 8%. That means 90% of the patients who have been treated with Naxwamika have been cured for their complaints. So instead of mentioning the complaints for which they have been cured, they will tell that Naxwamika in homeopathy has spoiled the liver of one of the patient. Patient developed cirrhosis and he died of so and so disease. See, definitely a medicine that cures the disease will produce the side effects. When the side effects are coming, they are ready to criticize scientifically. When the scientifically criticism of getting side effects is present, definitely there will be scientifically designed treatment also, benefit also available in homeopathy. That is our duty to maintain the documentation. So system review medical literatures, they evaluate best studies. So what is the defect with us is not maintaining again the documentation. See, it is the movement of popularized method, professionals, institutes. See, what we have to do is we have to take a movement. We have to, that in that movement, we have to definitely maintain a roster. We have to maintain a register that how many patients are coming. See, don't think otherwise. When we calculate money, how much we earned once we are going away from clinics, we have also should do that. How many case records we have taken, what is the document that we are managing. See, for maintaining the documents, it may need another 2 hours. You kindly collect another 10 to 15, 20, 50, some money, more money, but you kindly manage your data. And nowadays, computers are coming. So, if we do little data work, if we do little statistical work, if we enter their Aadhaar card and know the address, we can show to the world that this particular patient has taken treatment for ulcers in the stomach with me, and he came for 6 months. Whether he discontinued, whether he continued, whether he has been cured, we can record his statement. Yes, I am so and so, so and so, so and so. I have been treated. Now I stopped taking treatment from this doctor because I changed this place, or I developed another diabetes or something. I have undergone surgery for my fracture of the leg. So something has to be recorded, documented. You do documentation in any way, you kindly publish that documentation. If nobody is taking up for publication, you kindly publish your own book. That is enough for us to save the homeopathic system of medicine. And production of guidelines. See, you are treating a case wonderfully very well. You may select some medicine. Why you are developing your own theory of giving the treatment? Because you are not taught in your college how to treat the patient and what is curable, what is cure. These two things were not taught in your medical college. If you were taught in your medical college about what is curable and what is cure, you will not take up a case of constant convulsions. You will not take a case of malignancy, or you will not take a case of malignancy of the 4th grade. Or I have seen various physicians, homeopathic physicians, treating the case of hydrocele. A normal hydrocele, because of constant injury due to cycling, will not be cured because the transudate present in the hydrocele has to be removed and the testis has to be rotated and placed. Then only the size of the scrotum will come down. But homeopathic doctor, a newcomer from the college, number one, he don't know that he cannot cure a surgical case. And at the same time, What are the guidelines we have to give the patient also he do not know, because he was not taught about his limitations. This is the surgical case. Think that there is multi-dimensional fracture of the wrist joint or fracture of the ankle joint with 29 bones that met with fracture, and that fractures are automatically healed. And for early healing, homeopathy do have medicines. But what is the fracture? Whether that fracture needs surgery, after surgery we have to give treatment, or before surgery we have to give treatment. Are we in a position to apply bandage to that particular patient? Or have we learned the art of applying bandage in our college? These were not taught in homeopathic medical colleges. So he will take up the case because he needs income, money. So despite of ethically he knows that he needs surgery, he will not be in a position to express. See, he should be taught of how artistically he will manage the case of the fracture, and which orthopedic doctor he will refer the case, and how much money he has to take from case for attending the case, what are the bandages and medicine to be applied at that time to relieve the pain. He will not be taught in homeopathic hospital. He will be taught in homeopathic hospital how to make the fractured bones to grow as early as possible. You kindly give calcarea carb, calcarea fast, calcarea sulf, so that the fracture will be early healed. No, fracture has to be healed without any malunion. Fracture has to be healed without any surgery. Fracture has to be healed with surgery. So which surgeon we have to refer? Such type of studies are not present in homeopathic medical colleges. So that's why the importance of the statistics and maintain the documentation is, see, if you see an ophthalmology doctor, they never do any work. You kindly see in your city, they will do cataract surgery. Cataract surgery, the ward boy who is seeing that cataract from last 10 years also can perform that surgery. And that doctor will be very popular because he maintains the documents. He will write that today I have done 5 surgeries. This surgery patient is having glaucoma as well as surgery. See, he knows that glaucoma he can't treat. He will give the drops. The glaucoma is because of diabetes, or the arteries have been struck, and he treats that patient for cataract. He takes cataract surgery money. The vision will not come down because he is having glaucoma. The arteries have been shrunk because of either hypertension or because they are blocked because of diabetes mellitus. He says you kindly go to a diabetic doctor. How he has been well trained how to treat his eye without providing vision. He says that cataract part has been removed. You have glaucoma. You developed this arteritis. The arteries are totally blocked. You kindly go to your allopathic doctor who is treating you for diabetes. If your diabetes is under control, your vision may come back. How vision will come back? Until and that he makes some holes with laser treatment and removes the blocks from the arteries. But he never do because he don't have a laser machine. But he is having a machine to do the surgery for cataract. So such type of training is not being given for homeopathic doctors even in this postgraduate level. So he comes into the market and opens his clinic. You do not know that which cases are curable, which cases are incurable. For that, the preparation of regular policy mixing, production guidelines, practice of EM being in institutions and organizations has to be trained. Approach, why what I told is this is approach for evidence-based healthcare. How a allopathic doctor say the gangrene, what they will do gangrene, they will give autoclaved bandage to the patient. There will be a ward boy. Even allopathic doctor, MBBS doctor never applies the bandage. They will do the autoclave. They will do autoclaved applying the bandage daily to the patient. They will maintain the diabetes mellitus either with insulin or not with insulin. Why not we treat that applying the bandage, autoclaved bandage in homeopathic clinic? That is not a surgical practice. And if you add anthracinum or some of the medicine, along with the allopathic medicine, either insulin or anti-diabetics, that gangrene will get healed very easily. You will find one of the articles or some of the articles in homeopathy that varicose veins are curable, varicose ulcers are curable. You will find only one case, single case, and for single case he says that it is a evidence-based case and they publish. Why this single case theory is possible in homeopathy is that is just because of following the similia similibus currenter rules. When you are searching for a similar medicine, it is a toughest task to follow that. So naturally, you will take, if you take 10 cases to 20 cases of varicose ulcers, you can cure only one case. You have to cure many cases means you have to take thousands of the cases. So there the value of the curability, value of cure, what is curable will come. For that, you have to maintain the evidence-based guidelines. And these evidence-based guidelines categories of different types of clinical trials. I told in the beginning, see, everything never comes under evidence-based. See, evidence obtained from the randomized controls. See, you can do research, you can do randomized controls, you can have a placebo group, you can have a medicine group, you can have placebo and medicine group together in the patients. You can rotate the patient some days on placebos, some days on medicine. You can find out the period on medicine, period on placebo. If there are pathological investigations that have to be cured, suppose I have seen a case of cirrhosis being cured with homeopathy, but all cirrhosis patients can't be cured. This will not be taught in medical college. They will be only trained that homeopathy is against allopathy, homeopathy cures have been successful, homeopathy has been opposed by allopathic doctors, we are being done injustice. This such type of lectures will be given. But what is cirrhosis, how to manage that, how to cure that, how many cases we can manage, how to maintain the cirrhosis along with cirrhosis with the diabetes and hypertension, all pulmonary hypertension with cirrhosis, how to prolong the lifespan of the patient along with allopathy. Such type of practices are not taught in homeopathic medical colleges. Rather, they will be taught, again is the attitude of allopathic doctors. So, if we advertise that along with allopathy, you kindly take your lifespan will improve. In what is happening in cancer cases? Now, every fourth patient is a cancer patient. Now, as you found corona in 2019-20, now you will find in your clinics malignancies like that. In another 2 years, who will get malignancy? We will surprise that almost all, one person out of 4 persons is going to be a malignant patient. Like what you are seeing today, diabetes, after 2-3 years, you will see malignancies. So be ready with your malignancy medicines and malignancies. Usually the breast cancer, uterus cancer is going to be the commonest in within 4 years, like diabetes. So for that, we have to be tuned and we should be ready in treating, particularly in big cities, in middle class cities, because everybody can't go to city. So even the rural homeopathic practitioners, see, maintaining the rural practice is the toughest task than maintaining practice in a higher city. In city, what happens? Patients will choose the doctors. In village, what happens? The patient, there is no alternate. He has to come to you. A homeopathic doctor, you will also receive a pregnancy, delivery case also. So a rural homeopathic doctor should be highly skilled than in a city, because in city people are aware, they know for which disease we have to go to a homeopathic doctor. So you kindly advertise, popularize, improve, pass the information that for cancer, such and such homeopathic treatment protocol designed homeopathic treatment is possible. We will along with, so that lifespan will increase. But whereas in our homeopathic medical college, how to improve the quality of the life, the quantity or the how many days the life age span will increase, these were not taught and they were not trained. They do not know their limitations. they come into the society, they fail and they suffer with inferiority complex. When the inferiority complex comes, the standardization and the nobility of the homeopathic system of medicine, which has been cured, will disappear. And this is the reason where our colleges and infrastructures, excellent lecturers to give the guidelines. See, I will tell you one example what is the institution means. See, the Colgate manager or the Tata Industries general manager, managing director is being produced from IIM Allahabad. So IIM Allahabad, Indian Institute of Management, Allahabad is having best professors in their college. So that's why they are producing general managers, managing directors for Tata Industries, Ambani Industries, Reliance Industries. So you cannot ask the Tata general manager from which college you studied. Then you cannot ask the professor of the head of the department of manage in IIM, sir, why you never become the general manager of Tata companies? His duty is to produce general managers for others. So such type of institutes are not present in homeopathy, either in research or in college. So evidence are aspected in authorities based on clinical experiences. See, as on today, we do not have a wonderful homeopathic inpatient hospital. We have inpatient hospital in government sector. We have inpatient hospital for specialties, which CCRH is running, either bronchial asthma or autism or schizophrenia or skin disease. We don't have a general hospital of homeopathy. See, last week our Prime Minister has opened that too in Delhi. When we are getting 50 patients, we need 2 beds to maintain the patient. At least a patient comes, see, if we sit from morning to evening, if we work in our clinics for 8 hours, in 8 days, we will receive an acute patient. If in rural area, it will be scorpion bite or snake bite. In urban area, it will be injury and bleeding. They won't see whether you are homeopathic, allopathic, Ayurvedic, something. They want immediate bandage or tetanus toxide to be taken. So how to maintain that case and take money from him and send him to the proper hospital? Such type of evidence-based practices were not taught in our homeopathic college. So descriptive studies were not done. Statistical importance was not treated. Mathematical theorems were not treated. Why I am just reminding you today, this is the cure and curable. It is for experienced person like you. The cure and curable is like a small word, but a researcher for me, it is most important. So in my next seminar, next meeting, I will talk about cure and curative and how the relationship of the medicines came, how the antidote, how an antidote will become the complementary medicine, how the complementary medicine will become an inimical medicine, what is the science behind it, in which type of cases, that is about the curative and what is curable. I will discuss with the statistics next week, sir. Thank you very much.
Thank you, sir. Wonderful presentation. Every time you are doing a wonderful presentation and making us how to think. That is a guidance. You are giving always guidance to all doctors, because how to think and what is the meaning of the differences between each and every word we are using. So your classes are always very grateful to you for
No classes are learning
now.
from you. You are highly experienced figure. You are highly devoted people, sir. I respect your organization too much, because continuously you are conducting such webinars. And how motivation you need. See how many people are coming. 28 is a big strength for me. I am very
Now,
much thankful to you.
Today one doctor asked me, we have to make a study from each and every doctors, a same medicine for using for this purpose. So we can take the cases and the medicine used for a disease. Many doctors having these statistical studies should be done. And after that, we can give it to the government that these are the doctors are using, these are the medicines are using for the disease
Yes, sir.
and for
Yes, sir.
conditions. That is more evidence-based. It may be more evidence-based. One of
You publish your own book of cases you treated, sir. That itself will save homeopathy.
Thank you, sir.
You-
And now those who want to ask question to Dr. Prakash, sir, please raise your hand. Sir, please stop
Yes,
your
sir.
share screening, sir.
Anybody, sir?
Yeah, Dr. Danesh is. Dr. Danesh. Okay.
Sir, Dhanesh, sir, good evening.
Yeah.
Good evening, all, and good evening, Prakash Rao, sir. It's really once again you really rock the floor with your knowledge and your ideas, and that's really an eye opener for all, because all those things to be studied need to be looked into when we make a presentation. What are the things to be looked into, particularly in research cases, how one can move forward in those cases also. But as rightly Dr. Hibbert pointed out, that each and every doctor are present, doctors here are present in different cases. But even for example, for diabetes, a lot of presentations are undertook by our forum, and each and every doctor have different medicines with results, which give them good result. So if we collect those medicines and we can make a list out of it, and then we can publish it as these are the medicines that really work for diabetes. Like that, as you pointed out, that cure and curative are entirely different terms and entirely different aspects. I hope you are ready to present the second part of the same. Of course, we can do it in the third week of March, I think, so that that will give a better idea about the cure and curative aspect.
Okay. Yes, sir.
The excellent presentation. Congrats, sir.
Thank you very much, sir. Dhanesh, sir, thank you very much.
Sir, please stop your share screening, sir. Yeah.
Thank you.
Now, anybody want to ask questions, please raise your hand.
That's already 2:09. So
Okay. Now we can, we are all very much grateful to you, sir. You are doing your way of talk and your
yes, sir.
researchers.
Next time, cure and curative, it may look a general word, but for me, it is a biostatistical work. In the sense, I have gone to clinics like Dhanesh sir, Hubert sir. So I have checked their pharmacy, then case records like that. We have gone to every town, Bangalore, Chennai, Ahmedabad, Delhi, and then small village. Why their why Hekla lava is full present in their clinic? Why arsenic is being finished? Why Rastax is being finished? Why not zincum sulfatum or hepar sulf is not being prepared? So such studies have been made, and this is only the defect of our guidelines that have been given in our college. So I will talk about that next time.
Thank you, sir. Now we are very much grateful to you. Now we are passing to our Malayalam session, our local language.
Yes, sir.
Here we are concluding our English session.
Thank you
and
once again,
meet
sir.
together
Thank you, Dhanesh sir. Thank
tomorrow.
you, Manoj. I am not seeing today. Our Dr. Purubji not came today. Okay, sir. Hubert sir, thank you very much. You kindly.
Thank you, sir.
Yes, thank you. Namaskar,
Now,
sir.
Dr.
Namaskar.
Mariama going to do our Malayalam session, moderate our Malayalam session. You're welcome, Dr.